thanks for the opportunity today to present my poster. In summary, what I've been doing is a bit of a journey to get to where I am today. So I finished the Masters in Advanced Clinical Practice at Greenwich University last summer, and as a result of my dissertation, this was my next steps to do. So I've always been looking at Attention Deficit Hyperactivity Disorder in children and young people with ADHD, as that's part of my role in the clinical nurse lead that I have within Kent Community Health. So what I found with my dissertation is I couldn't really, in the time constraints, get children and young people's views. And actually they were the people that I really needed to understand more to develop our service and our staffing culture and delivery of that going forward. So what this work has looked at is a questionnaire that was already something that was on my radar to ask children and young people for clinics in a mainstream school. I plotted the mainstream school in a rural area which had significant deprivation but was within an affluent locality. When I looked at our data in trust, I saw that we had quite a high was not bought attendance to this area, and in addition looked at the demographics and saw there was a higher population of the travelling community for the area where I implemented the school clinic. So what I really wanted to do was reduce the non-attendance to appointments, understand how we could support as a health service that engagement for children with ADHD that were prescribed controlled medication on the whole, so that we could improve their health, not just health outcomes, but their educational attainment as well. So doing this in school allowed us as a healthcare team to not be working in silos, that we were working with the education sector to understand better the children that needed our input and intervention. So while I was reviewing the nurse-led part of the service and the medication clinics, it was much more than that. It was about, as Dr. Gillian alluded to earlier, that collaborative approach, going further, working with the educational sector and what we need to do differently, rather than just prescribe medication and off you go, we'll see you in 6 months' time, didn't feel right. So now what's happened is when we're in the school clinics having these medication reviews, we have that open door policy where teaching staff can come and talk to us, ask us questions about a particular pupil that's of relevance to their ADHD management and symptom care. We all know that neurodevelopment isn't going away, it's getting bigger, and actually the way we're delivering our health service at the minute is largely through NHS hospital clinic based. We also have quite a lot of the children with ADHD, a diagnosis of autism or on the pathway for that assessment. Coming into hospital is really scary for them. They find it that the first thing they say to me is, "You're going to take my blood." I'm like, "No, I'm not going to take your blood." And what I need to bear in mind is the environment has a massive impact on both their engagement and the family's engagement. So moving these clinics into school has really enabled the children and young people and their families to feel more trust in the partnership working between us and education and supporting the child's health needs fundamentally. So what's happening now is I finished the Springboard Award, attained the Child and Young People's Views, which was brilliant. I've now applied further for the Future Leaders Award, and what I'm hoping to do is build that up into more of a research project so that I can actually look at the child's journey into adolescence, because we are missing a trick. What's happening is a child gets diagnosed with ADHD, maybe from 6 upwards, and then they go to adolescence and there's a bit of rebellion, they don't understand the diagnosis, and we're not actually doing any educative work around what that is for that person and what that journeys look like from 6 to 13. So what I really want to do now is understand their experiences and how we can shape their experiences into what our service can offer so that we get that engagement. 70% of our non-attendances to these appointments are teenagers. We also know that it's a really important time for their education in terms of GCSEs, and also children with ADHD, not every child, but also has a higher risk of going into the criminal justice system. So if we can work with education and understand their needs more predominantly from our health perspective, we may be getting things a little bit better than what we are now. And that's all I've got to say. Thank you.
Thank you, Gill. It's such an interesting piece of work, isn't it? And the way that you've engaged these clinics in schools, really, really fantastic. Thank you. Sort of on the research side, I think you started this work. You did a systematic review, I think. Can you just tell us a little bit about what you identified from that review in terms of the gaps in this area?
Thank you. So the biggest gaps were there were not clinics like this in schools that I could find. There was asthma clinics, there was like school health nurse clinics, but there wasn't ADHD clinics. So that's why I was like, why are we not doing this? So most of the papers I had came via Google Scholar because there wasn't anything on Cochrane. But what I did manage to pull from, say, Cochrane was then more sort of clinics that were established, like the asthma trials and how that had benefited by being in a more community-based clinic.
So that's really, really interesting. You can take the principles from other studies and apply them to your own. So that's great. Thank you. And then I noticed that you'd used this Child Outcome Research Consortium survey. Mm-hmm. Can you just say a little bit more about that and what the challenges were with getting people to kind of engage with that survey?
Of course, yeah. So we didn't want to put pressure on anyone to complete the questionnaire, but it was offered at every review clinic appointment. So it's out there in the wider domain to access, and people would take it away from the clinic, and the school had like a little waiting area. They could complete it there and give it back to the school receptionist, which was their preferred method, because they said if they went home with it, they'd forget about it. And they said, I've got ADHD, so it's best for me to do it here and get it done. But there was no pressure because they left the clinic room with it, and then what they did with it was their choice. So the response rate of what we had, I had to whittle down, which is what I want to build on the next steps, because I was really trying to hone in on the teenage viewpoints, and not every child that come to this clinic was of the teenage years. So I got 16 responses to the questionnaire. Putting that into context, we'd only done 5 clinics, so there was only potentially ever going to be a response rate of up to 25 children and families.
So that's pretty good, thank you. And I think you've already told us a bit about your next steps in terms of, doing a Future Leaders Award, perhaps. You're going in that direction. It's really great. So maybe just tell us what's the greatest thing that you've learnt from doing this project?
Thank you. Yeah, there is another step as well, so I've got to highlight that. It's really important. This has been a great journey. I think my head of service is kind of getting tired of me, because I'm like, right, let's do this now. Let's not stop because it's working. This is my evidence. So what's happened is I've branched out within KCC and met with the educational team. I don't know if anyone's heard of the PINS project. So there's a lot going on in West Kent around a pilot for children and adolescents with neurodevelopmental needs, primarily autism, because everyone's got such a long wait. Our service is currently 4.5 years wait. So I met with them because I'd presented my work, I think through one of the ARC CYP sessions online, and someone linked in with me that way. And then as a result of that, we're now going to be spreading these clinics into 4 schools in West Kent, which KCC have mapped where they need to be. So they're not going to be like next door to each other, but like what I've done with this school, put it in a rural area where we know there's deprivation to try and encourage that engagement. So they are the next steps, and it's been a great opportunity for me to actually put from my dissertation, my recommendations, what I wanted to do next, be able to deliver on that, and then have more recommendations about where I need to go to next and improve service delivery. So thank you.
That's great. Thank you so much, Jill. Thank you.